thanks for being a volunteer at ARVS. We're going to go over a couple things for helping out with the spay-neuter clinic. First thing, we're going to start with pre-op. If you're assisting in pre-op, what your duties are and how to do it well. The first thing before we get going is rule number 1, don't get bit. So if we ask you to hold a cat that you're not comfortable holding, there is absolutely nothing wrong with telling us, I'm not really comfortable holding that cat. I appreciate that and I'll never be mad at you. What I don't ever want you to see you do is if a cat is getting loose from you, you should never grab their tail or their back leg. I will be mad if I see you do that because you could get bit and hurt. We have gloves, we have cages, we have towels, we have all sorts of ways to safely handle a biting cat. So rule 1, you don't get bit. If a cat does get loose, and it will happen, it's not the end of the world. What you should do is, if you are not the most experienced technician, you should probably not help catch the cat. I'm usually the one that's going to catch that cat. I have a net that I can use. What you can do to help, though, is you can get out of the way so you're not chasing the cat. You can pick up Jack Rat so that he doesn't get scared. He needs comforting when this happens. And you can lock the door. So we need to make sure the door stays closed. We may want to close windows if windows are open and we want to protect Jack Rat. That's what you can do to help if a cat gets loose. All right, so let's talk about helping out with pre-op. We obviously bring cats out of the carrier, and typically I'm the one that's going to grab those cats out of the carrier. However, if you do want to learn more, once you've had some experience and you're good at holding cats, I can start to teach you how to take them out of the carrier. Once they're out of the carrier, we're going to put them on the scale and get a weight on them, and I typically do this also. And once I get a weight, I tell Van, who's being my pre-op tech today, that this cat weighs 9 pounds. She's jotting it down on the menu that we use for all these cats. The other things that we do on that menu is if I find any abnormalities on the physical exam, I would tell them, and Van would write them down for us. She's also in charge of making sure that the circle sheet has on it everything that we're going to be doing today with the cat. And this particular circle sheet has already been filled out. If it hadn't been filled out, she might be asking me, are we going to neuter this cat today? Are we going to do distemper and rabies? Are we going to do a microchip? She might be asking me what we're doing, and then she's going to do a circle, and you can pan right in on that. She's going to do a circle right over everything that we're going to need to do. Like this is the distemper vaccine. We're going to give that, so there's an open circle there. I might say after she says, okay, we're going to give a rabies and a distemper, I might say we're going to boost 1 year, 1 month. That's for the person on the computer, so they know how to enter that in. And you'll note that the circle on boost rabies 1 year is actually circled on the 1 year. That's because there's no action that needs to be taken, so we don't need to check that off when we've done it. But it's still there to let them know. That's just like if I said to Van that this cat had fleas, she would, and it doesn't, but if it did, she would circle the word fleas, because we don't really need to do any action with that. We don't need to give it fleas. And then she would circle above revolution. Revolution is a topical that will get rid of fleas. And because that would be an open circle, that would tell person in post-op, which we'll go over in another video, that they need to administer revolution to that cat. The other thing that Van's doing while I'm doing the physical exam is she's making sure that the top part of this form is completely filled out, okay? This wasn't circled as a male cat, so she would probably ask me, is this a male cat? And I would say yes, so she would circle the M for male cat. The other thing that isn't there is the age isn't there. You'll see it's blank. So she can flip that form over, and sometimes the clients will put down an age. They wrote 7 months here. So what she would do to make my life easy is she'd go, they said 7 months, does that work? And I would say, yes, that works. And she would write 7 months. So 7, and then she circles the M for months. We're just listening to his heart. Okay, now we're ready to administer the anesthetic. Okay, this is where as a technician you're going to assist with things. We're going to get the cat's carrier back up. And let me talk a little bit about restraining. Restraining cats, The best way to restrain a cat is to get a hold of their scruff, to hold directly behind their ears, okay? That's as opposed to a scruff hold here. I think you can probably see the difference in that. A scruff hold here, this cat can certainly get around and nail me. Again, no one gets bit. Second thing that I do when I'm holding them is I'll oftentimes pull them in towards my body. I'll get a hold of their scruff and then a hold of the back. Do you want to take that for? What I'm looking for with the hold on the back is cats will oftentimes do a little bit of a roll and smack you with their back claws. They hurt. So by having a hand on the back, we can keep that cat from rolling and feeling what, we can feel what the cat's getting ready to do before we do it. We tend not to put a tight restraint on the cat until we need to. If we put too tight of a restraint on and really push it hard down onto the table, even the nicest cat's not going to like that, and it's going to make your life a little more difficult. I do not ever want to see any of you bringing a cat up towards your face or kissing a cat. That's just dumb. You should never do that. You can do that to your cats, but you don't do it to a cat that you don't know, so no one gets hurt. So we're going to go ahead and give this cat to Van. We're going to get that carrier back up. While she's getting to know the cat for a second, I'm just drawing up the anesthetic that we're administering. When we give the anesthesia, usually about 3 seconds after I give the injection is when the cat doesn't tend to like it. We're going to position that cat facing towards the carrier. So as soon as I give that shot, the cat can run back into the carrier. So Van's got a good hold, a good scruff. I'm doing the injection. Saw the cat wanted to run. She moved it towards the carrier and let it go in. So now we'll wait for it to go to sleep. Okay, so once the cat's asleep, it'll take about 3 to 5 minutes. Then as the tech, your job is to take them out of the carrier. As far as the carrier goes, I have a pet peeve about carriers piling up in areas that we're walking with. So it's best to give it to the person in post-op or to put it in one of the bottom cages or someplace where we won't fall over it, because we'll have 25 carriers at the end of the day, and that's a lot of carriers to be tripping over. All right, what you want to do when you're prepping the cat, we use something called artificial tears ointment. Do know there are other tubes of things in my drawer. Every tube is not artificial tears ointment. So you want to make sure you're using the right thing. We don't want to put ear meds in the eyes or anything like that. So look at your label. Make sure it says it's eye ointment and it's artificial tears. To administer, and we're going to use a tube that's already opened and a little more collapsed. To administer eye meds, it's important that you not touch the eyeball. You can transmit disease that way. What I do is I make a glob of the medicine, I just drop it onto the eye, and then I close the eye. And then I get a drop on the eye, and I close the eye. So that's going to keep the eye from drying out during surgery. Then you want to cut toenails. We're not going to go into a lot of detail here on this video about how to cut toenails, but that is something you're going to do. If you don't know how to cut cat toenails, ask us. We would love to teach you to cut toenails. So we do front and back toenails. If you see broken nails or you think there's something wrong with a nail, it would be a great time to bring it to my attention. Or if you notice any wounds on the feet, don't be shy, ask me, and I will tell you if it's a problem. Then you're going to clip the hair. All right, using clippers. Clippers are best used if they're held flat against the animal, okay? You're going to be less likely to hurt them, cut things you shouldn't cut. That's as opposed to this. And sometimes I will see people doing this. That's how you cut an animal and you get a lousy cut that way. So it's flat against the animal. About the only time I'll come at it this way is if I have an animal with really long hair, I'll push that long hair down and just get it nice and even, okay, with that, just to get the long hair out of the way. When you are doing clipping, especially for females, the better, the more symmetric you make the clip look, the better you make the surgeon look. The people can't see how nice my muscle suture are, but they can see how nice your clipping is. So you make us look good if you can make a nice looking clipping. I do prefer more clipping than less clipping because if we don't get hair out of the way, then it's harder for me to be sterile, and we want to be sterile here. All right, so to clip a male cat, let's turn so that hopefully you can see. What I do is I usually, with one hand, I hold the feet up. I kind of come into the side of the testicles. I'm not trying to get really close here. I'm just trying to get some of this hair off, okay? Now, Places I need to be careful when I'm clipping, I think the first place is pretty obvious, okay? The anus will bleed like a stuck pig. It hurts. You don't want to touch the anus with the clipper blades or you will make the anus bleed. So that's problem number one. Potential problem number two is the penis, and I leave that area alone. Occasionally, when you're clipping, you'll have a penis that's kind of protruding out a little bit like that. Be very careful. If the penis is sticking out like this, do not run the clippers over it. Do not take off the tip of the penis. Okay, so we're just going to leave that area alone, but we're aware that it's there just in case it wants to cause us a problem. I got most of the hair away so that I can see what I'm doing. So now I'm going to do the actual clipping for the surgery. I grab the testicles in my hand and I come along and try to get the hair off, okay? The first time you do this, it's not going to be this easy. Go slow, be patient, it will come. I don't know what to tell you to make it easy other than do 6,000 of them and then it will be easy. So we're just going to get that hair off of there. Now, the other way that we clip animals is if there's a fold of skin, and we'll talk more about this with the spays, but if there's a fold of skin, you need to be careful when you run the clipper over it. And what I'm talking about is if I were, say, to hold this up like this and get that area really folded in. If I went hard with the clipper right there, what I'm going to do is I'm going to take that hair off and I'm going to take that little layer of skin off. Now, if you clip an animal, you get too close and it bleeds, do not feel bad. I'm going to do surgery on the animals. They're on pain medications. They have other things to worry about other than a little cut in the skin. But at the same time, we try to avoid it if we can. So I'm being careful of that area, knowing that there's that fold there. Getting all the hair off the balls, and that's looking good. So if you do this, you get the patient to this point and I'm still doing surgery over there, you can start doing your initial scrub. Now there's two scrubs sitting here. One is light blue, one is darker blue, one is on the left and one is on the right. The one on the left-hand side, that's the lighter one, that's the scrub solution. That's the one that's really doing the cleaning. The other one is just a solution. That's taking off the soap, because if you leave soap sit on the skin, the dirt is still there. You got to take the soap off to get cleaning. So this is where we're going to spend most of our time. And if you have time on the pre-op table while I'm doing surgery, then you can start the scrub. So I picked up one of these lighter colored ones from the left, the scrub pad. I'm holding on to the testicle and I'm really cleaning. I'm not shy about it, okay? I'm going to try to do this type of cleaning for probably 30 seconds to a minute. This is just the initial soaping up. We do this with boys and with girls to try to start getting things clean. Now, one thing you're going to notice is I don't clean the anus, or if I do clean the anus, I clean the anus and I'm done. It goes into the garbage after I've cleaned the anus because we don't really want to be getting stuff from here and bringing it here, okay? So then I would sit here as my tech and I would wait for the surgeon to be done, then we move to the surgery table. Okay, so let's take a minute and talk about the clippers, okay? Things that you need to do to keep your clippers working well. If clippers get filled with hair, they get hot. If you notice this is like uncomfortably hot to the touch on your finger, it's really hot to the touch on your patient, and you can burn cats if you try to with hot clippers. The way we keep our clippers from overheating is we keep our clippers clean. Now, in my lowest drawer, where I usually stand, you'll notice I have some clipper products, okay, that we're going to talk about using. Pretty much after every patient, it's not a bad idea to just get the toothbrush from the lower drawer and make sure there's no hair on it, okay? That's going to cut down the heat on it. Certainly, if you say clean a wound or you get some diarrhea, or if it's something really ugly, you spray a little bit of this cleaner on it and then you clean it, okay? The other thing that you'll notice with the clippers is, and you may not see this on the video, but it's made up of little metal blades. If you notice one of those metal blades is gone, or you drop the clippers, look to see if one of those metal blades is gone. If one of those teeth is gone, if you use that clipper, you will inevitably cut the patient, okay? So it's trash. If one of these breaks off, throw it away, or let me know first and then throw it away. And don't feel bad, they're not that expensive. All right, to look inside the blade to see if we need to clean any further, there's this little bar here. You push that bar in you grab the front of this and you pull it back, and then that can come off. This blade is very clean, but while I have it out, I'm just going to make sure there's no hair there. I'm going to look in here, make sure there's no hair. A lot of times there'll be a big wad of hair right here, which you can clean out with the toothbrush. Then after I know it's clean, I'm going to put this back on. It slides on. You getting that? It slides right onto that peg. To put it back on then, I just stand the whole thing up, I turn it on, and then I close it, okay? So now it's going. Now every time you clean the blade like this, you've taken the oil off the blade, you have to re-oil the blade to keep it running smoothly. To oil the blade, what you do is you turn it on, and you do 2 drops. 1 drop on one side, 1 drop on the other side. Resist the urge to do lots of oiling, lots more drops, because the hair will really stick to it. So that's how we maintain our blade. Okay, so we've got our next patient ready to go. This is a spay, and one thing you do want to do before you clip for a spay is make sure there's no testicles there. Every once in a while we get a boy that someone calls a girl. It makes me sad if I get in to do surgery on a boy because no one looked to make sure. So this is definitely a girl. So we can go ahead and prep her. Okay, what I tend to do is I'm looking for the belly button. I keep my blade flat like we talked about, okay, flat against the skin, and I'm going till I find the belly button. Okay, and I found the belly button. The belly button, let me just clean it up a little bit for you. The belly button is, if you can catch that, it's that little scar there. Everyone has one, you have to find it. As far as, well, what areas do I want you to clip? I want you to get about 2 fingers above the belly button. I want you to get about 2 fingers on either side of the nipples on the belly button. I want you to go to the teats below the belly button. Not these guys, but these guys, the next set of teats. So I would make a nice square. Now, when I am clipping, I am aware of where the nipples are, and you'll often notice that I'll pick up my clippers just before I hit the nipples. If you just, you know, like here, flat, push, and go, you'll take off the nipple. There'll be some bleeding. It won't be the end of the world. The cat will not care. It doesn't need it anyways, but you'll feel bad. So try to avoid doing that if you can. And we like our patients to be as comfortable as possible, so that would be ideal not to do that. All right, so this is a nice clipping. It's nice and square. It looks kind of pretty. It's 2 fingers here, 2 fingers here, 2 fingers here, down to the teat below 2 fingers, and about 2 fingers below the teat. So I've covered the right area. I've made it square. This is a short-haired cat, so I don't need to do any further. If this were a long-haired cat, then what I would do is I would come in, and I flip that long hair in this direction. This has just a little bit of those hairs, and this is where we talked about coming at a different angle. I would carefully come down like this, getting those long hairs out of the way, okay? After I'm satisfied with my clipping, oh, and I forgot to mention, you probably noticed I went in one direction, I went in another direction, I went into another direction. That's how we get a nice close shave, because hair grows in different directions, so coming at it from different angles will get you a close shave. Then I'm going to use my handy dust buster to take some hair off, so I just... Okay, so now my patient is done. Surgeon's still working, so to kill time, I'm going to take my scrub solution, and I'm going to not be shy about scrubbing this patient, okay? The whole area that I went ahead and took the hair off of, I want it nice and sudsy. And the more time that can sit on the patient, the better off we're going to be as far as disinfecting goes, because contact time is disinfecting time. And I will leave that on the patient until she moves to the surgery table. So we'll move her to the surgery table.